Okay. Well, everybody, thank you for joining us today on this panel about learning agendas from planning to action with all of these wonderful folks. First, I just want to say thank you to the planning committee, especially Laura House, for helping organize all of this. And additionally, our partners as well, the Atlanta Area Evaluation Association, there we go, Washington Evaluators, and FedEval for help spreading the word about it. And then finally, of course, our wonderful panelists, and we'll let them introduce themselves here in a moment. But first, I just want to take a second, only because so many of you fine folks had reached out talking or asking about what you could do, what the government evaluation TIG could do, and what AEA could do to help facilitate rolling learning agendas out at the state and local level. I think that's a great idea, and it's worth extra discussion. And what I would recommend, I'm going to put my email in the chat here. Send me a message if you're interested in being a part of that group, and we'll form something to start those discussions. Okay. So with that, I will turn it over to our speakers and just ask them for a 3-minute bio. Tell us who you are, how life's going, or how it worked, whatever. And let's start with Emily, because she's up at the top. Oh, you can't unmute yourself.
Hello. Hi, I'm Emily Schmidt. I'm the Deputy Director of the Office of Planning, Research, and Evaluation in the Administration for Children and Families. ACF is a part of the Department of Health and Human Services. We are a grant-making organization. We oversee about 60 human services programs, mostly through grants to states and local human service agencies or other local entities.
Great, thank you. How about Marina?
Hi, I am Marina Volkov. I am the Director of the Office of Evaluation, Performance, and Reporting at NIH. I think folks are fairly familiar with NIH these days. You know, it's where Tony Fauci works. And our office is in the office of the Director of NIH, and our mission within our office is to build capacity throughout NIH for strengthening stewardship activities, including evaluation.
Great, thank you. Dan.
Hey everybody, I'm Dan Kidder. I'm at the Centers for Disease Control and Prevention, and I'm serve as the Chief Evaluation Officer there. I also oversee a monitoring and evaluation unit in the Program Performance and Evaluation Office. We are, for those who aren't familiar with us, we have been in the news as well, but a lot of people may not know that we're also part of HHS. We're one of the operating divisions within HHS, along with NIH and others that shall introduce themselves as well. So I've been at CDC for almost decades now, which is weird to say, but doing a variety of things in HIV prevention and so forth before I came into my current role.
And Laura.
Hi, everyone. Good afternoon. I'm Laura House, and I am at the Administration for Community Living. We're also in HHS, and our mission is to ensure that older adults and people with disabilities thrive in the community and participate fully in the community. We are also primarily a grants-making organization, and I work in the Office of Performance and Evaluation in the Center for Policy and Evaluation, and I am a Senior Management and Program Analyst.
Awesome, great. And Shilpa.
Welcome, everyone. I am lucky to be with so many esteemed panelists. I am Shilpa Clift from USAID's Bureau for Policy Planning and Learning. I sit within the Office of Learning Evaluation and Research as one of the team leads and oversee the design and implementation of the Learning Agenda, as well as other Evidence Act implementation and requirements. Looking forward to this discussion.
All right, great. I realized in my haste to get this party started, and apparently my cat wants to join. I forgot to introduce myself, Chris Vogel. I am the chair of the Government Evaluation Topical Interest Group with the American Evaluation Association, and the president of the Atlanta Area Evaluation Association, if that matters. So with that, let's roll. Now, this first question, I'll preface it by saying, since the signing of the Evidence-Based Policy Act in January of 2019, if I believe that's accurate, a lot has happened in the world since then. As part of this question, I'm also just interested in where you all are at with learning agendas. But the question being just, what has your overall experience and process for developing or starting to think about learning agendas been so far? And if you have made progress on it, how long have you been doing this? And is this time length expected for what you anticipated? And I'll just open it up to anybody, and I'll throw out, because I often forget stuff, put your questions in the chat, gang, and if we have time, we'll get to it at the end, but we'll try to follow up with questions we don't get to. So anyway, sorry, action.
Well, I can jump in and just say, so our office at NIH is a relatively new one, and it came into being in right around the time that the Evidence Act was moving through Congress and was signed. So for us, in coming up with our initial learning agenda, at that point, HHS, of which we are part of too, had a bottom-up approach where each of our individual agencies had the opportunity to create our own learning agenda. In our case, it coincided very nicely with the creation of our office. So for us, our learning agenda was easily crafted into the mission of our office, in that we had as our learning agenda building capacity at NIH, which again is the mission of our office. And it just so happens then we were able to come up with evaluation plans on a yearly basis for building capacity. These are all things we wanted to do. And the Evidence Act came along at really the perfect time to help us with this effort to get our office going in a very strategic and planned way to build evaluation capacity throughout NIH. NIH has always done evaluation, but as any agency can always do it better.
I can jump in. We had a very similar experience to Marina in that we had USAID had developed our first agency-wide learning agenda in 2018 prior to the passing of the Evidence Act. And so over the past year, we have revised the agency learning agenda to align with the FY 2022 to 2026 USAID and state joint strategic plan, as well as the emerging agency policy priorities such as COVID-19, climate, diversity, equity, inclusion, and accessibility, among others. And so as we are going through this revision process this year, really pulling together our stakeholder consultations across our missions in Washington, as well as working with external stakeholders to really understand learning priorities and critical evidence needs for this new set of policy priorities, and using that to draft a resulting 8 learning questions that will kind of guide our work with stakeholders as we go forward. So it really has been, taking into consideration what are these driving policy priorities across government, but really kind of trying to still pull that bottom-up approach of speaking to many of the stakeholders in diverse geographies and in diverse sectors to really understand what are some of their greatest gaps and challenges, and how will evidence be used as they're implementing these policy priorities in the coming years.
Great.
I'll jump in. Some similar aspects of our story, some different. So I mentioned we have about 60 grant programs in ACF, but some of them are quite large and some of them are quite small. So we have about 9-10 that are really focal areas of our research and evaluation. And predating the Foundations for Evidence-Based Policymaking Act, but along with the conversation about learning agendas, we had really started working on an individual basis with each of those program offices on a learning agenda. So for example, our Head Start team lead was working really closely with our Office of Head Start colleagues on developing a learning agenda, and our childcare team lead was working really closely with our Office of Childcare colleagues. Meanwhile, we're of course also reporting up to HHS as part of their learning agenda. So in the middle, what we've really been prompted to do by the Foundations for Evidence-Based Policymaking Act is try to come up with an ACF learning agenda that rolls up all the really deep work that's going on in each of the program offices and presents it in somewhat of a standard and accessible format to talk about what's going on across ACF. So that's kind of our middle layer. And then above us is the HHS learning agenda. And below that middle layer is the program office specific learning agendas.
Wow. Okay. So yeah, layers. I love it. Laura or Dan?
Sure, I can jump in. At ACL, we're one of the smaller optives at HHS, and we started our work on our learning agenda back in the latter part of 2018, early 2019, just as the Evidence Act was passed. And we also, like others, took a bottom-up approach. We didn't have other, our centers, we have 7 centers at ACL. We didn't work with them to develop their own learning agendas, but they contributed to the overall learning agenda. We wanted to make sure that we included the voices of all of the different components of ACL. We did a lot of intensive stakeholder engagement, internal engagement with those centers, the leadership, and we came up with a list of actually 74 priority questions across our seven centers. And from that, we narrowed those questions down to 11. And our senior leadership helped us to, or they identified the top questions for the agency. And we are working, we have one question that we've been working with for 2 years on caregiving. And we're doing a lot of work right now around that particular question. But what we found is that collaboration, which is something that the Evidence Act really pushes and promotes, is key. And also getting the leadership of the support of leadership. So we've had a good experience so far. We don't yet have our Deputy Assistant Secretary, so we're waiting for that individual, our leader, to come in and also weigh in on our learning agenda as we move forward.
This is Anna Reineck, and I have been using so many different platforms. I forget how I raised my hand in this one, so I apologize for just bursting in. But I'm listening to all you guys, and I've been following this, and it's always really engaging and impressive to hear from all the different agencies that are more what I would call heavily research and grant focused. I'm a USAID groupie, I think, from their resources on their website and things. But is there any, I come from a smaller agency in USDA, the Animal and Plant Health Inspection Service, and we're so much more regulatory. And I think that hurdle might not have been crossed yet in terms of the relevance and value for this kind of work for those kind of purposes, if that makes any sense. Like literally when I talk about this, it's like, oh, well, that's the grant making people, you know, or whatever. So thank you, Steve. But that's just my comment and my experience is that I think people just don't yet appreciate the value of this in a bigger way.
Panelists, any thoughts on that?
Well, I can speak a little bit to that last comment. You know, I think that I think you're touching on something that's really important, that a learning agenda is not just for thinking about programmatic decision making. It's also thinking about how the evidence from learning questions can be used in operations and thinking about those adaptations that might need to be made based on that evidence. You know, I think one of the things that as we think about kind of the strength of learning agendas is really in driving the how do you drive use of evidence in decision making, and whether that be looking at something that's more regulatory versus something that is more programmatic. I'm happy to speak to that as we kind of progress through the questions. But I think that that point that was just made is one of the points that we can make in kind of really advocating for the use of learning agendas, is that it really does span across that range of decisions that we're making in terms of strategy, programming, and operations.
All right, thank you. And Christine, I see your hand up, but I want to give Dan a moment to chime in with the original question, and then I'll get to you.
Sure, yeah, and I think our others have touched on it. Those of us who are part of HHS, there's sort of the things that happen within our operating divisions or optives, and then things that happen at HHS. And so it's kind of shifted over the last couple of years in the way that we've approached this. With the way that we were developing and putting things in place and developing the learning agenda in 2020 was based on our agency priority goals and the leadership at the time. People may not be familiar with the fact that CDC is extremely decentralized, and that's partially because of the way that funding comes in into our 13 plus different centers. And so funding decisions and so forth, and the ways that evidence building and evaluation and research and so forth occur, and programmatic activities, all of that is really driven by within each center. So we serve more as a coordinating body and so forth around things, and we don't do and decide about how they use their funds for evidence building. So our approach was more around what are the agency priority goals? What are we doing in these areas? Who are the different groups, the different centers? Sometimes they are cross-cutting. Sometimes they're, things like, say, pandemic preparedness and so forth, or are cross-cutting. And then there's other things like ending the HIV epidemic, which was a priority under the last administration and is still a priority, is focused more on in the HIV prevention area and so forth. So our role was really to look at what are the agency priority goals, how do we work with them to find out what their priority questions are, and what evidence are they collecting to build and develop that. And then a pandemic hit right when we were trying to do that, and people got kind of sidetracked. And so there's not been, there's still, the work is still going on, but we're really, stretched pretty thin as far as the ability to kind of get things from people and do really in-depth activities these days on some of those things. The activities are still going on and so forth. And then with the new HHS priorities and the new administration, we've been kind of waiting to see what those are, and along with our agency priority goals. And so the plan is to build based on those and the new directions and the new things that we're focusing on for this. So I think now as we go forward with some of this, again, we're more of a coordinating and how do we work with programs to make sure that they have ways to collect the evidence, and that they're thinking through these questions and then following up with them, rather than kind of being a top-down approach from our direction. And I see that some of our colleagues are on who are doing what we hope will happen in some of the individual centers, which is to develop their own learning agendas within the centers based on their priorities. And one of the centers is really taking the lead on doing that. And that, I think, is a really great model. We're going to have a webinar coming up within CDC on what they're doing to build that and the things that they're doing. And that really brings it down to the points where kind of they have the ability to kind of look at what their portfolio is and where they want to go. So that's kind of the way that we're thinking about it. We may not be kind of quite as far along as some of the others, but I think there is a lot of activity that's happening around the agency. And now that we've got more stability in kind of the way that we're going and the priorities that we have, the intention is to kind of how do we compile all this and make sure that we're pushing forward and using the evidence. I think one other thing which we haven't quite touched on, but I think was part of the question, is how do we get people to understand this? So part of a lot of our work has been just educating people on what the heck this is and how is this going to help us and that kind of thing. And so and what does it mean for our work? So that's another set of activities that I think is really critical as we think about how we encourage programs to collect evidence and use it for the decision making.
Thank you, Dan. And I'll go back to Christine. You have a question or comment?
A little bit of both. Comment on regulation. I feel like we should not neglect process evaluation, and that hits home with regulators. Are the systems we're using to enforce our rules actually effective or non-value added? Even internally, I think we have internal controls that if one gave a hard look at it, they check a box, but they don't necessarily catch a problem. So I think the whole process side of government, which is where you get most of the complaints from the public, I don't know how to find, I don't know who to go to, and on and on. So improving our processes should be prominent in our agendas, and it also serves equity. So many of our systems are just hard to access. Just a quick comment, I'm the evaluation officer at the Department of Commerce. I think the biggest effect of the Evidence Act for us is more of a departmental presence. We have these wonderful statistical and scientific agencies, Census, BEA, NOAA, NIST, and their information and data now is being more integrated into the evaluation processes of our social service agencies. So it's been a good thing. Thanks.
Great comment. Thank you. One point that I wanted to touch on with the original question is the amount of time it has taken you all. I know this was a conversation that existed before the Evidence Act was actually implemented, the concern about just time and resources dedicated to it. I heard that a lot back in 2017, 2018. So I'd be interested on your perspective on that. Was it a lot of time? Was the juice worth the squeeze, if I can use idioms here? And just your general thoughts on that.
I'll jump in first and say that it took us a year, a little over a year, to really pull together our learning agenda, our initial learning agenda, because of the deep stakeholder internal engagement that we did with ACL leadership, managers, senior leadership managers, and staff. I think it was worth the juice because it really allowed us to sort of understand what the priorities were across the agency, and to really begin to look at those cross-cutting priorities, the differences. We were able to look at, are there points at which we can meet, that we're doing some of the same things, that we can use our resources and our time more wisely, and work together to address some of these questions. So yes, I do think that it was worth it. And in fact, we were able to create a question bank based on the work that we did. We created a question bank of questions that we can go back to and look at for future learning agendas, and also what we called an evidence inventory. We were able to create that as well, where we have a repository now where we are putting a lot of our evidence to answer our top questions.
I'm going to make
Emily, you go ahead.
I was going to make a related point that doesn't exactly answer the question, but when we published we ended up calling our research and evaluation agenda, the subject matter experts who contributed really insisted that we call it a snapshot, because they said, well, we're not done yet. How can you publish this? And we said, well, we want to reflect where we are at a point in time. What have we done? What are the questions we have on the table now? But we wanted to really put language in there that says, this is a reflection of this point in time. We're not done thinking about our questions. We're not done consulting our stakeholders. This is an ongoing effort that we're documenting at this moment, and it's to be continued. So I find it hard to answer the question of how long did it take, because I think anytime we're documenting what we're doing, it really is just capturing this moment in time of what is ideally an ongoing effort to answer questions, take that information into account, feed it back to your stakeholders, get input again, and keep moving forward.
Yeah, and like so many tools in evaluation, they become living documents that will continue to change through the years. But Marina, yeah.
Yeah, I wanted to just jump in and actually refer back to something that Hannah Fitter put in the chat box for Dan about the decentralization of CDC, NIH, we are 27 different institutes and centers. And very much as Dan described for CDC, that situation exists at NIH. The budget is directed to each of the centers and institutes and not to the overarching. So the learning agenda gave us the opportunity to work across all of NIH and to talk about what are the common issues that we are all dealing with in trying to even do evaluation. When we talk about capacity building, we spent our first year of the learning agenda, our evaluation plans were all around trying to get sort of the baseline here. What kinds of capacities existed throughout, because we are so decentralized. But what can we do working together to build on that? So for us, the learning agenda, the opportunity of the Evidence Act has been really important for trying to congeal a more centralized approach across a very fragmented agency.
Great.
And I was typing in the chat a response to that. So thanks for bringing that up, Marina, because I think you touched on a lot of the stuff that I was going to say. And yes, there are, thanks for the question, Hannah. I think there's a lot of, downsides to having a decentralized approach when you're looking from a central perspective, right? But within the programmatic areas, it gives them a lot of flexibility in the focus and the ways that they want to approach things. So it does take a lot of work for us to talk and work across the areas. And there's a lot of examples we have. And I think a lot of people put a lot of effort at CDC and working across these different funding areas. And this is not our choice. This comes from the way that funding comes from Congress. So it comes in as center level budgets. So that's the part of the reason for it. And there are cross-cutting initiatives that we have going on, such as our data modernization initiative. And of course, the pandemic includes everybody across the agency, pandemic response, emergency response, and so forth. So I think we do, like Marina, I think we're not the only ones that are that way. Marina and others are decentralized as well. And it does give us, I think, this Evidence Act, as people become more familiar with it and understand the things that we can do once we do coordinate and think about these things and make those connections across groups that may not have been familiar with each other. I think it gives us a lot of levers.
Great. Well, and I think that leads into the next question pretty well about, how have you identified your stakeholders for creating the learning agendas? And specifically, if you are this far along, how long did it take to engage them? And what sort of additional value, perhaps even beyond what you expected, did they give? So I realize that's like 3 parts, but I'm just interested in your experience engaging stakeholders, given the structures of your organizations are so both different and unique.
So I think building on just that last kind of comment on decentralization, USAID is this huge decentralized agency, each country mission having really its own portfolio and challenges and context. And as we're pulling together the learning agenda, we looked to an exercise that we do annually, which is compiling that internal list of technical, sectoral, and geographic learning agendas, especially the ones that are managed out of Washington, and engage those points of contact to ask, to involve them in the process, but also to ask who else and which mission should we be speaking to, and really use that as a process of making those connection points with the learning efforts already underway in order to kind of understand how they are generating evidence towards the agency policy priorities. We also engage country missions from every region in which we work in order to kind of hear how a very similar issue such as migration might look differently if you're looking at our Latin American and Caribbean region versus in Africa. And really, and then lastly, really engaged as the new administration was starting as strategy teams or task forces, policy teams were just beginning work. looking at how could we ensure that learning is a part of their process right from the get-go, and build in asking those questions of what are some of those key learning areas that they are looking at, and seeing how the learning agenda could play that role in really pulling together those diverse stakeholders. One thing to note in having implemented a learning agenda for 2 years before we went through this revision process is our focus has really kind of turned towards how can we play that connecting role across a large decentralized agency. And so looking at where we can pull together peer-to-peer learning events to bring together someone in global health or someone in agriculture together that are working on very similar issues, but may not have been connected because of the ways in which we operate. We've also thought a lot about the role that we can play in synthesis. So how there's a lot of existing evidence. So how can we repackage that to kind of begin to generate evidence towards some of these key questions, and synthesize it across sectors, and then package it in a way that's easier to use. It's more digestible, and it's really kind of getting at what are some of those needs that we heard them say in the next 6 months or to a year. And then lastly, have done a lot of work with supporting evidence use. And I think that this is something I just wanted to say a little bit more about. I mean, over the past decade, USAID has developed an evidence base on how learning agendas are used in the agency, and how the use of learning agendas affects evidence in our strategies, operations, and programs. And one of the key findings has been that we're very strong at designing learning agendas that are used to generate, capture, and disseminate evidence, but we face challenges getting beyond dissemination. So it's challenges in actually getting to use in decision making. And so we built out a really long revision process in order to really understand needs. We learned that we need to design our learning activities with our end users in mind, and to actively facilitate evidence uptake with those users. And so you really have to understand what are those key processes where we can kind of leverage the existing program cycle and existing meetings, events that are occurring. We also found that it's important to think about our learning agenda not only as a document or a series of products, but as a behavior change process. So just as we might do other programming focused on behavior change, we use the learning agenda to better understand the opportunities, motivations, and ability of staff to engage in learning and evidence use, and to build enabling factors that help drive evidence use, like capacity and incentives. And so the agency learning agenda kind of plays that critical role in really not just thinking about the learning questions themselves, but also that broader role that we can play. And so I think just to talk about that time, and then as others have said, when we think about who do we engage and how do we engage them in that time that it might take, it's really from the outset trying to think beyond just the questions, but the processes that it might take to actually use any resulting evidence from those questions to really change behavior and to begin to build that culture of learning at USAID.
Can I just say thanks for that perspective? I thought we were decentralized. You're like the whole world purview. So.
Anybody else have thoughts on stakeholders engaging them? Because I do have a related question, and it really relates to Amia's question, and then as well as Jennifer's in the chat. With this notion that getting all of these different stakeholders in different parts of your organizations to do learning agendas requires some level of building buy-in, and maybe even some evaluation capacity building in there as well. So I'd be interested on your thoughts on how you have built buy-in, if it was even needed, and then any sort of thoughts you have on future outcomes for better evaluation in the future.
So the Evidence Act, in our case, gave us a great opportunity as we had our learning agenda to really engage with NIH leadership, to sit down and talk with the leadership of all of our different institutes and centers, and to really say, okay, we have a mandate now to do this kind of work. What do you need? What evidence do you have now? What evidence do you wish you had? And by engaging with our leadership, I think that it helped us tremendously in trying to build capacity across NIH to get a good feeling for what is needed for the agency as a whole. So even going back to the stakeholders question, for us, it's the stakeholders that we focused on at this point are very much our internal stakeholders, because we are focused on that capacity building for the agency as a whole. I think as we move along, we'll be able to focus on other stakeholders as well, our research community, the public, etc. But for now, it's a very inwardly looking process.
I'll jump in on the stakeholders question as well. So I would also say our primary stakeholders have been our program office partners. And then there's also been a few kind of focused exceptions. So Federal Register notices or advisory groups that were convened for pretty specific purposes. But then I guess on a larger point, sometimes I think that this story is told as if we were like sitting in our office by ourselves, and then the Evidence Act came around and we were like, oh, let's go talk to some people. And so that's not true. And so a lot of the stakeholder input that we reflected in our learning agenda is from like ongoing relationships with program partners and researchers in the field who we like see and talk to at conferences or in other collaborative settings. And then also, research itself is a feedback mechanism. So we do surveys and focus groups and interviews with program participants as part of our research projects, and that feeds back in. So I would say our focused stakeholder outreach for the learning agenda is really to our program office partners, but it was also reflective of this kind of ongoing stakeholder relationships that we've had and built over time.
I'll jump in and just say, I mentioned some things about our stakeholder engagement initially in the initial development of our learning agenda. Initially, it was internal stakeholder engagement, and we are more centralized than a couple of the other agencies that have spoken. We're more centralized and we're smaller. But I will say that stakeholder feedback has still been a little challenging, in part because routine communication changed due to COVID. And so just at the time when we were ready to do external stakeholder engagement, the pandemic came. And so we weren't able to do as much or the type of external stakeholder engagement that we had hoped to. But I think what we've noticed in the implementation phase, we've noticed a few things about stakeholder engagement. We've noticed that for implementation, that it's important for it to be a team effort, but that there's still a need for a point person or small leadership team to move the process forward. We've learned that it's important to track your implementation process and have clear goals and outcomes that your agency can verify with the evidence that it's collecting. And then just multiple check-in points at all levels with senior leadership, with program leadership. That's key to making sure that the buy-in is there at all levels across the agency.
And I'll just tag on a little bit to the buy-in piece, because I think it's a really good question. And I think some of us have been fortunate to be in places where this has been built over the years. And like I think Emily said well, this wasn't just like, hey, look, here's something totally new and we haven't been doing it. We have had the CDC evaluation framework, which has been around for over 20 years now, and a lot of people who have spent a lot of time building evaluation and the understanding of it. I see Tom Chappell is on, the former chief evaluation officer before me. Hi, Tom. I worked with for many, many years, and others around the agency who spent a lot of time building up the understanding around this. Now, that doesn't mean that it's gone all the way through the agency, but we do have, our project officers all have to take the program evaluation courses so they're familiar with it. Our notice of funding opportunities have evaluation built in. And so to me, the Evidence Act, and we worked with Nick Hart and a lot of other people who from the early days when this was being formed, as we this is going to be a lever for us, another thing for us to point to that, like, this is important. And I think the supporting documentation that's come out that said evaluation is a critical agency function is a huge thing for us to say, look, we're not just telling you evaluation is important because we think it's important. It's also something that the federal government thinks is important and important for us to improve what we're doing. So I think it's an iterative process. It's probably, for those of you who are in regulatory agencies, maybe it's different than where we are. I think we do have a lot of people who come with this kind of lens of research and evidence building is important, but it may be a little bit of a shift for them to think about how do we continuously use this and use it for improvement and so forth. So it's a slow process, and we're kind of, again, using this as one you say arrow and quiver arrow. Anyway, one of the things we can use and for helping us push this forward.
Well, great. Unless anybody has anything to add to that, I was going to move on. Okay, well, and I'm going to take a pause on the questions because I see in the chat that GAO is on the call. So I believe it comes under Valerie, but I think it's Terrell that's online. I don't know if you had your technical difficulties sorted out, but I was going to give you the opportunity, and you folks play a role in this. But I don't know if your tech is working.
I think Terrell is on the call, so go ahead, Terrell. I see you in the chat.
Okay, yes, I will try. Forgive my tardiness. I had an appointment earlier, and I hope that I don't crash, but I put a few things in the box that I hope will be helpful. I spoke specifically to an issues and evaluation series we have. We've certainly considered and have done engagement work on a lot of these issues. So we'll invite you to read some of our engagement work, which we can make available on our webpage, and we can also make available to this audience. And first, let me commend you all for an excellent session. This really is helpful. I also invited you to let us know if there were particular issues you wanted to have further discourse on, because our issues and evaluation series would, that we partner with the Data Foundation and with the OMB evidence team to bring these projects into sharper focus. I will leave it there because I think that we have a lot of work that sort of addresses and even supports the use of engagement work. But a few things that I will observe from what I've heard is the intentionality that's brought on by the Evidence Act of bringing stakeholders together. And I believe Laura House said the collaboration between the key stakeholders in the Evidence Act, the data officers, the statistical officers, and the chief evaluation officers. I think that that is critical because, with all of those people involved, you are able to consider the data you have available, the right questions, and you're able to make sure that you are maximizing potential use of the evaluation results. And I know that probably a lot of people have said the same things. I have experience in the executive branch of government working at both United States Environmental Protection Agency, as well as the United States Small Business Administration. And we had a lot of success in starting the learning agenda process before the Evidence Act. And we did that with a very intentional eye towards multi-stakeholder engagement. And some of that, I would encourage you to look at the SBA guidelines for program evaluation, or contact Brittany Borg, who is the director for evaluation there, because there's a lot of good stuff going there. There's a lot of good stuff going on everywhere. It's evidenced by the conversations that I've listened to. But we certainly would like to entertain more and to contribute in any way that we can. And Valerie Caratelli, who's here, is also the administrator of the FedEval listserv. So, that's another way to communicate with us. And I just thank you for putting this on and for giving us an opportunity to join.
Thank you, Terrell. Yeah, much appreciated and great comments. I love it. I guess I'll open up if there's any responses, comments to the panelists. What Terrell said. Okay. Well, we can move on.
Comment that the series that they put on are great, and if you haven't joined them, you should.
Nice plug, yes. So the next question then, in your experience of crafting and or using a learning agendas, have you identified any pitfalls or points of concern for their creation or use that folks should be aware of? So yeah, a lot of people are interested in the process of putting these together, but also any insights you find folks have learned about going through the process to whatever degree you have. It's been perfect.
I'll just make a quick comment. I think anytime you do, one of the things that we run into is when you do this very high level learning agenda, it necessarily has to focus on a certain set of areas that may be, priorities of administration or the agency and so forth. And just what do people say, hey, is my stuff not important because I don't show up in the learning agenda? And so, that's where, to me, some of these center level, division level thoughts happen, where you can dig down and say, not only are you important, but we want to make sure that we've got a way to represent you in the things that you're doing, and to have what we call strategic science and some of the things that we're working on with the Office of Science around how do we think strategically around the things that we're doing at the high level, and then at the individual level, and everything kind of, we can get the puzzle pieces, I'll look at the puzzle pieces together rather than this program doing this and this program doing that. So to me, that's a big benefit of it. And I don't know that exactly answers the question, but to me, it's something that I think is important.
Well, it reminds me a lot of the common concerns among when you do organizational logic models as well, ensuring people are represented, but if they're not, then still incorporating their work in some way. Yeah, Laura.
I just want to throw in a quick thought, which is a pitfall: resources. I don't know how many of you have a dedicated budget for learning agendas, but I don't think many agencies have yet set aside the resources that would be helpful to implement learning agendas. And so it would be nice to get just some ideas, some estimates of the resources, the level, the types of resources that agencies need to use of different sizes in order to develop and implement learning agendas. And for agencies to begin to think about, setting aside resources in their budgets for the development of learning agendas.
I think just building on that comment, I think across the board, everyone's response will be resources. But I think what has been even more challenging, I think, as I was mentioning earlier, it's really hard to advocate to leadership and to others in government to kind of get past just evidence building and evidence generation. I think so much of the emphasis is on how are you going to use evaluations to answer your learning questions, which is a very important question to ask. And yet one of the challenges that we have is that all of our agencies have been working in evaluation, have been building evidence for decades, and that it's really that the lack of resources for facilitating evidence use, for building capacity in using evidence, in holding those peer-to-peer exchange events or even interagency exchange events, in thinking about kind of, once again, synthesis and repackaging of evidence. I mean, driving that behavior change in the way that we use evidence in our policymaking and our decision making is really difficult to advocate for. And I think that has been a big challenge as we're now all in this phase of where we are in implementing our learning agendas, is really acknowledging that with evidence, it's not the old saying, if you build it, they will come. That's not true for evidence. Like, we really have to work with stakeholders to get them to use the existing evidence, to have it easy to access, And so, just to really drive home that point on resourcing, it's really looking at resourcing across the entire knowledge cycle of, generation, capture, sharing, and dissemination to use. Thank you.
Oh, that's great. Well, and I think that's a great segue into Steve Souza's question, but also my last question on here. Steve's question, how are you using the Evidence Act to promote evaluation within your agencies? Do you have any examples to share? And he makes the suggestion a repository of various agency artifacts, such as evaluation questions, surveys would be great. But the bigger question here is, what opportunities do you think could exist for interagency sharing of learning agendas or resources that were made?
So I can jump in with, sorry, Marina, did you want to?
Oh, well, yeah, let me just quickly say that for those of us at HHS, HHS is awfully big, and each of the octaves have their own piece of the HHS mission. And for us, even I would love to see more coordination across the agency. We do have some efforts at coordination, but to be able to share, especially data across the agencies, the evidence that we are generating individually within CDC, AFR, all of those, if we were able to share that data, I think it would be extremely helpful, but it also won't be easy because our data is unique to our mission as well. So how do we create a common space for us? And that's only within the agency. When I think of a USAID and your charge, again, you've given me great perspective on decentralization. So I'll let you go, Shilpa.
Yeah, and I just wanted to add, I think, USAID has been working with the Department of State very closely on our joint strategic plan. And so as a result of this, the Evidence Act teams at each agency have been sharing our learning priorities and our questions, and really thinking about how we might build on this collaboration in sharing points of contact on questions that are similar, and thinking about what are those opportunities for evidence exchange. And so thinking about that on a larger scale, that has been really valuable to USAID to understand, to look not just at that list of learning questions, but to really have those opportunities to engage with Department of State on similar issues. And so in terms of ideas for, or where opportunities might exist, I think, thinking about that on a larger scale, like many of us are asking similar questions about, COVID-19 and about, our work in diversity, equity, inclusion and accessibility, both on the programmatic and operational side. And I think the presidential management agenda, government-wide learning agenda is looking at kind of connecting, elevating some of these shared questions and to help with some of that coordination in evidence exchange. But I think that it is really at more of this working level where I think finding not just not just those opportunities for shared questions, but also for doing those types of peer assist events that we, here. That's something that has been so valuable to the work that we do across missions in bringing missions together to kind of think of challenges. Well, how can we apply that to more of an interagency model? Are there kind of questions that could guide our interactions together so that we are able to kind of workshop challenges around a shared learning priority, whether that be on the operational, where I think there's a lot of shared questions, or on the programmatic, where we would be wearing somewhat different hats and bringing somewhat different experiences to the table, but the kind of that implementation or programmatic experience, within that there might still be some novel solutions to the way that we are working. So just building on kind of how we've done that across missions and across our colleagues with the Department of State, I think that there could be really great opportunities for kind of going up a step and looking across the interagency.
Okay, well, I do see we're at time. I have one more, I think, question or comment, but it's related to what, I'm all fuzzy for some reason, to the point I made when I started off, and that's that a lot of folks have reached out about how to implement this or how the government TIG AEA could help facilitate this rollout in the local state level. And just before everybody hops off, I was going to throw my email in the chat again. Shoot me a message if you're interested, and we'll pull together a group to start thinking about this. But back to the resources, there was interest then in also sharing it besides interagency sharing. If there was a possibility to share with state, local people, as well as just civil society in general. Is that an option? I know there are clearance rules and all of that, but I'm just curious if that has been discussed in any frame.
So that's at least for USAID, that's something we're thinking a lot about over the implementation of this new set of questions, is how can we engage external stakeholders, and that's across kind of our civil society, non-governmental organizations, but also thinking very much from a localization agenda and working with local actors from a DEI perspective of getting a diversity of perspective. So we are thinking very much about collaboration and evidence exchange across that broader range of stakeholders.
Great. Okay, well, with 2 minutes left, I'll just call out here that James, Anna, and Steve and Woody, I see you all had questions in there, and anybody else that as they come in. I will record those and send them out to the panelists, and if they have time, perhaps they could respond to it. But I also wanted to make mention of Stephen Mumford's chat, that the quick plug for a survey the Data Foundation and AEA are currently conducting with federal eval officials across the government to gather info on Evidence Act implementation and access or assess capacity needs. So if you're on the list, you would have received an email Friday with a survey link, but there's, and if you didn't have that and you're interested, reach out to us and we will connect you all. But with that 1 minute left, I love it. I'll also take down these questions and comments a little more generally and see about sending people not only the link to the recording, and we'll put it on the AAEA YouTube, but also any sort of follow-ups as well. So again, thank you for your participation in the panel. It was wonderful. I loved it. Yeah, and I'll just open it up to panel. Any final thoughts, comments?
Mike Hampton, I thank you for the invitation.
Yeah, I mean, partially for us, just learning from other agencies and how we're all doing this is just so valuable. So we have endless conversation, not endless, a lot of conversations with others, but we look forward to more dialogue around this as we all learn how to implement this better. Thank you.
All right. Well, if that's it, gang, everybody on the call, thank you so much for joining us. Like I said, we'll follow up with an email, and have a great rest of your day.